Good afternoon. My name is Michael Large. I'm one of the Urologic Oncology Fellows at University of Chicago. I'm here to discuss our recent submission to the ASCO GU Symposium in 2012. Our study is entitled Empiric Antibiotics for an Elevated PSA, a randomized multi-institutional placebo-controlled trial. As we found in reviewing the literature, it's a very common practice amongst community urologists, medical oncologists, and primary care physicians to prescribe a short course of antibiotics to men who present with a newly elevated PSA. We performed biopsy on men of any age with PSA greater than 2.5 who were asymptomatic. And what we did was we randomized them to two different arms. One was an observation arm and one was a fluoroquinolone antibiotic, which was given for 2 weeks. We then proceeded to biopsy with these patients. We found that of the men who received antibiotic and had a PSA increase versus a PSA decrease, there was no difference in the incidence of prostate cancer. Likewise, for patients who were in the observation or placebo arm who had a PSA increase versus a PSA decrease, there was no significant difference in incident prostate cancer. Furthermore, if you look at the relative decrease, there was still prostate cancer present in patients who had an overall decrease in PSA of greater than 50%, and of those patients who had normalization of their PSA to less than 2.5, there was still incident prostate cancer in a small number of those patients. So our conclusion is that the prescription of empiric antibiotics to asymptomatic men for an elevated PSA is not of any clinical benefit. Thank you.